Hi friends, I'm Dr. Abhay Talathi, cosmetic dermatologist practicing in Mumbai. And at DERMA TV, today we are going to have a very nice interaction with eminent doctors from USA, Dr. George and Dr. Christopher.
Hello, so I'm Christopher Zachary. I'm professor and chair of the Department of Dermatology at the University of California, Irvine. And on my right...
Yes, I'm George Hruza. I'm the president of the American Academy of Dermatology, an adjunct professor of dermatology and otolaryngology in St. Louis, Missouri. And I'm really happy and looking forward to this the DERMACON this year.
Yeah.
So officially welcome to Pune and India.
Thank you.
So let's get ahead in the discussion. Today we are talking on something as aesthetic dermatology in resource-poor setting. So actually in India it's on the rise that we are doing a lot of aesthetic treatments now, but the affordability on the part of patients as well as abilities to have multiple resources in the clinic is limited. And I think probably your inputs from your experience about aesthetic dermatology in such settings can actually be very valuable. So probably we can kickstart the discussion on that.
Sure. Well, from our point of view, you know, when our dermatology residents, when they leave the residency program after 3 years, they're pretty much trained in general dermatology, surgery, lasers, cosmetics, but at the end of the day, they have to go out into a private practice where they won't have all these resources. So actually, we have exactly the same situation back home, where you have to decide what you can afford, how effective these devices are going to be, and indeed what's going to make a difference for you to develop a successful practice.
Well, certainly the key thing is in resource-poor countries is who's going to buy a $100,000, $150,000 device. It is just not practical, because then how much you have to charge, you really can't make that work. So there are many techniques available which don't require that big capital investment. So what we use in our office, a lot of surgical techniques where you just need some minor instruments to be able to improve aesthetic outcomes. And on top of it, in India, you have patients with skin of color. And so if you use devices like lasers, often you end up with pigmentation, with problems with pigment darkening of the skin or lightening of the skin after procedure. So what I find that's very helpful is using surgical techniques such as subcision, where you actually, if you have someone with acne scars, instead of doing something from the top, you actually go in underneath using special kind of needle called a no-core needle, and then you can go underneath and just break up that scar, loosening it up. The needle costs a few cents, and of course local anesthetic, and you can achieve some nice improvement, and you have no risk of hyperpigmentation or darkening of the skin. So that's one technique that I find very helpful for acne scars, and it can even be used for certain wrinkles as well, especially if you do combine it with filler material. So if you do the subcision and then you put some filler material in there, I know that gets a little bit more expensive, but still not as much as some of those big expensive devices. And then you, by placing those in there, you can get a longer-term improvement in the appearance on the surface.
So while we're talking about acne scarring and relatively inexpensive things, all the rage these days is microneedling. And microneedling can actually achieve something, but to get a really good result, you really need to add radiofrequency to microneedling so that you can actually quite specifically put an area of injury at different depths down to 2 millimeters into the skin, where you will create new collagen, new elastin. And I think the research demonstrates that you can improve acne scarring, but it does pretty much nothing for skin tightening unless you use the radiofrequency. So microdermabrasion, you will see it out here in the technical exhibits. People will talk about microneedling as though it does everything, but actually I think we must be aware of the fact that it has limited benefits.
Right, definitely. So we are doing a lot of subcision, and actually subcision is one of the common modalities which we perform in our settings also for particularly acne scars. and we are using derma rollers as well, which is manual micro needling, though the results may not be as good as the machines, but definitely if you have no resources, it's good to begin with. Then probably other challenges which we face is that, when we want to select the device, in our resource poor settings, what we are doing is that we are trying to get the devices which are multi-utility. So you look at an IPL systems, which are probably less costlier as compared to that of other sophisticated laser machines, but they bring in a lot of utility. So we can use it for acne, we can use it for rosacea, we can use it for skin rejuvenation, some brightening photofacials. So we are trying to utilize like multiple indications with one single device.
And I'd agree with you. I'd agree with you with IPL can do many things. Well, I think one of the most common lawsuits in the United States is the use of the intense pulse light, particularly in skin of color, when, particularly if you turn the energy up and don't have enough cooling, you can cause a lot of problems. So have you experienced that here?
So skin of color definitely needs a different type of parameters and treatments as compared to probably a Fitzpatrick 1 and 2 type skin. So you have to adopt to your type of patients. So the energy levels are low, the filters are probably different. So we have a dark skin filter for hair reduction if you're using IPL for the hair reduction. So definitely the laser parameters have to monitor and change probably based on the treatment which you're offering to different patients. So we have skin types from 3 to probably 5.
Yeah.
So even the parameters would differ between type 3 to type 5. We are using a lot of chemical peels for skin rejuvenation and brightening. That's also something which comes at reasonably lesser price, and it's easy to perform in clinics, doesn't take a lot of patient time. Patients have to be guided about how to take care of your skin, because again, your skin is going to exfoliate. There is a chance of hyperpigmentation of the skin. But if you have exact understanding of what type of skin you're treating with what type of solution, then definitely the results are rewarding.
So moving from acne to hair removal, I think our experience would be that use of the long pulse 1064 is much safer than the diode 810 or the Alexandrite 755, or certainly than the ruby. Of course, the ruby laser was the original laser that was used. It was so effective by Rox Anderson and the team at Wellman, who did so much in terms of laser development. So 1064, for those of you out there watching this show who want to do hair removal, 1064 is a lot safer than some of the other lasers.
Right. I mean, the 1064 is optimal, and you can get that on a number of devices where you mentioned the sort of platform device, where you have one base unit and then you attach a number of attachments. So you have a 1064. You can have the IPL, you can have some other fractionated heads on that too, so you can get these multiple ones. However, realize that when you get a multiple head device, once you combine all the different heads, you could still be at a very high price point. So it gets challenging because each additional, they say, oh yeah, we can get you that, it's another $30,000. And this one, oh sure, another $30,000. And then the service contract, of course, will be another 10 or 20. So it still can get quite expensive. You mentioned chemical peels, and I think for patients with skin of color, it's an area you've got to be really careful. And so you, of course, are the expert, I think, in that area.
Yeah.
I would think that most of the time you would be using things such as glycolic acid peels, superficial peels, and multiple sessions. Be gentle. You don't want to be using like sort of TCA or even phenol. Certainly would never be something you'd want to use in India. So using those superficial peels is key, and then I forgot what my last comment was.
So the other point is when we get down to things that work, in terms of cosmeceuticals, this is a multi-billion-dollar industry out there, and most of the cosmeceuticals do nothing for you at all. Yes. I think there are about 5 things that work. The retinol obviously works. I think sunblock works. Yes. And moisturizers, I think, work. I think the hydroquinone works. Yes. And maybe vitamin C and other antioxidants. But beyond that, I'm not sure that any of the cosmeceuticals work. What's your experience?
So, if you look at using the cosmeceutical, we are using particularly the retinol, which is useful for anti-aging to an extent for young seborrheic skin also to reduce the oiliness of the skin. For pigmentation, definitely the first choice of most of the dermatologists here, including me, is hydroquinone.
Yeah.
So we are using hydroquinone to reduce the pigmentation like melasma and some other acquired melanosis for about say first 4 to 6 weeks, and then we are moving to the other depigmenting agents. Moisturizers are helpful, though in some of the places where the humidity is very high, the amount of the moisturizer which you use or the type of the moisturizer which you select is going to be a little different as compared to the areas where it's more on a drier side.
Right.
Sunblock is essential. We are a tropical country, so we have a lot of sun exposure.
Yeah.
We are definitely using sunblocks.
Yeah.
My understanding, or I would like to know one more thing, is that suppose we are trying to look at anti-aging treatments now.
Yes. Yeah.
How do we use it, like resource-poor setting, to have the effective anti-aging treatment according to you?
George, what do you do?
Well, Chris, you kind of mentioned some of the most effective ones, and so retinols I think are relatively inexpensive, so those should be easy. Hydroquinones are not for aging, but because of the pigment issues here, I think that's a key part of any procedure. The antioxidants tend to get more expensive, and I'm actually not sure if they've been shown to do much of anything.
Right.
Because the problem with, for example, vitamin C is that as soon as it gets exposed to oxygen, to air, it oxidizes and becomes inactive. So I don't even know how we're getting activity there. And the science certainly is not there to support that. But I think actually the best anti-aging agent out there is good sunscreen.
Yes.
I understand that in India, of course, skin of color means that you don't get the sunburn.
Yes.
However, you still get aging from the sun, so you want to have a broad spectrum sunscreen. The important part is it's going to cover UVA, ultraviolet A, because that's I think what leads to the elastosis and the damage in the dermis that causes wrinkling. So
Yes.
I'd say good sunblock is the key thing to use, and the ones to use in this setting probably would be there's a whole controversy about chemical versus physical sunscreens. Yes. But with skin of color, the physical sunscreens, the problem is when you put it on, it kind of looks white, not very attractive, so you got to usually go with the chemical. And there is no evidence to suggest that those are in any way unsafe, even though there's been a lot in the press about it.
Big controversy in the US
big controversy
right now.
in the US right now.
So we have actually tinted sunscreens as well, which suit your skin type. So people who are a little darker skin has a little darker or a tinted shade so that you can match your shade.
Yeah,
perfect.
Because it has to be cosmetically acceptable.
Yes.
Otherwise, people don't use it even after you recommend.
So we've covered a lot of the basics here. If you're going to use something which is a bit more technically superior, I think the fractionated lasers have really made a big difference, particularly the 1927 fractionated laser, thulium. It's quite useful, and also in patients of color, skin of color. And I find that you get very little in the way of post-inflammatory hyperpigmentation, but you can induce PIH with really anything, right?
Of course.
And so, hey, I think if you've got the interest and you've got the market out there, some of the fractionated devices can be really good, not only for pigmentation, but also for anti-aging, for collagen development, new elastin formation.
Well, I think it's really important to, as you mentioned, non-ablative fractionated lasers. And when you use them, the settings are going to be different than what we would be using in the US, which usually means just lower density. So you're going to have lower density and then of the spots, and you do more treatments to get the same result.
Yeah, I think it's a very important point. The density issue is key.
Yes.
Keep it down. You can always do another treatment.
Right, yeah. So one more understanding which I want to bring out here is that a lot of people are not able to buy the lasers in the clinics. If you have your own setup, if you don't go to hospital, you have to buy all the machines, then it's difficult to acquire all the machines. Do you think that injectables have a role? Because what we realize is that some indications like maybe few wrinkle reduction with botulinum toxin, dermal fillers, even though the resources, like you have technical skill, but you are not willing to or able to buy the whole system at one go. Yeah. Probably as a building block, you're starting anti-aging with probably reversal of wrinkles and maybe few hyaluronic acid syringes, and then enter to the device system.
I mean, I think that's exactly fillers, and the neurotoxins are not just a great way to enter the process, but you again don't have the problems with hyperpigmentation issues. because this goes into the skin, and it's a very quick result. So patients love it. I mean, if you do a neurotoxin, you inject the crow's feet, and they disappear. I mean, that's magical in 2 or 3 days. And the fillers, same thing. So I would say that's certainly where you want to start before you spend $100,000 on a device.
So George, have you ever had any Botox?
I will admit I've never had a filler, but I have had Botox. My problem with Botox for me is that I really don't like to get shots. So when we do it in my office, it's about one every 1 or 2 years, and they've got to put topical numbing cream on me, and I'm still like, everybody says it's a nightmare to give it to me. So yes, I have had it, but it's quite infrequent.
So that's important in terms of pain and the fear that patients have. And we always use a 32 gauge needle, which is in many people's almost imperceptible. But my friend George here is a sensitive chap.
Yeah.
Okay.
Well, men are just much worse than women. I tell you that.
Let me tell you a good trick, though, for your patients who know that they're going to faint, that they have the vasovagal attack. It's always a good idea just beforehand to give them a little atropine, 0.5 milligrams, subcutaneously or intramuscularly. Wait for 10 minutes, and they won't faint. So it's a good little trick.
I think that's cute. Even though I just have patients always lying down when I do these things.
Lying down,
that's really important.
So we are also using 31 gauge needles for Botox.
Using what, sorry?
31 gauge needles.
31,
which are for any botulinum toxin injections.
Yeah.
And I feel considering the Indian perspective, probably in resource poor setting, we start with microdermabrasions, derma rollers, chemical peels, add on to some injectables, and as you gradually upgrade your practice, your patients also feel that you are doing good work. You install machines, and then it becomes a resource-rich setup.
So and then body shaping is all the rage these days, and obviously body shaping, body contouring is going to be something that's going to cost some money. But the first thing I say to all my patients is diet and exercise. I could do with that myself, of course, according to my wife. So diet and exercise, and then remember that it's not liposuction. It's not going to give you the same results, and you don't get rid of the fat. If you use cool sculpting, it's going to redeposit that same fat somewhere else.
Right.
But the whole body contouring business is very big in the States. Is it big here?
It is getting bigger.
Yeah.
But in resource poor setting, it's not something which we'll get into that.
Yeah. Very good.
So it's great interacting with you, Dr. George and Christopher.
Yeah.
Pleasure talking to you.
Thank you very much indeed. We appreciated it. Thank you.